Is Dr. Mark Larson. He's an emergency medicine specialist over at St. Luke's Hospital. Dr. Larson, thanks for taking some time.
No problem.
Now, there's been a lot of confusion over masks the past couple of months. In hindsight, have we moved too slowly in coming out with this recommendation to wear masks in public, in your view?
Well, I think it depends on what the prevalence of the disease is in the community. I think that having the masks available that people are wearing is going to protect them as much as anything else. It also helps protect the spread if the patient may be infected and not aware that they're infected, and if they're coughing in public, that's going to help prevent that droplet spread of the virus to whatever they may be coming in contact with.
So do you recommend the wearing of masks out in public?
So I'll fall in line with the CDC's recommendations and what's coming out of the White House at this time, and that yes, if you're out in public, that it's recommended at this time that people are wearing masks.
You know, lots of talk about homemade masks these days, given the shortage of masks across the country. How effective is a homemade mask?
You know, I think a homemade mask is going to be protective. Again, if someone's coughing and may be infected, not aware of it, it's going to kind of drop down some of those the droplets and prevent that spreading. It's going to provide some protection against the virus if someone is near you and coughing near you. The other thing that some of these masks do, which is a secondary benefit, is it just prevents you from touching your face so frequently. The main way that we worry about spreading this is really from contact and from droplets. And if you're touching a doorknob and then you reach up and touch your face or do something in that area, you want to make sure that you're not getting in contact with the mucous membranes. And so the masks really do a good job of trying to prevent you from touching your face.
If you're going to make one, what material should you use that might be available from around the house?
You know, so there's been a lot of guidance, and St. Luke's Health Systems actually put out on their website some information about how to safely make masks, and we've actually even distributed material to sewing clubs and people around that are interested in making masks, because we want to make sure that you don't have a false sense of security. And wearing an old T-shirt or a do-rag around your face may provide some level of benefit, but having a higher knit fabric, even things like vacuum cleaner bags have been shown to provide a higher level of filtration. So the more dense the material that you're using, the better protection you're going to receive.
Describe for us how the mask should fit on the face, doctor, and how snug should it be? Yeah,
and that's a good point, because you want to make sure that the mask that's as it's fitting, it's covering all your airways, so it's covering your nose as well as your mouth. I see a lot of people wearing it just over their mouth and not covering their nose, and realizing that there's two portals of entry to get air into your lungs. So you want it to fit snug across the bridge of your nose. All the masks that are made from a surgical standpoint all have a little metal band that goes right around your nose, and you can crimp it down on the soft part of your nose to form a nice seal. And then the loops to go around your ear to keep it nice and tight, snug to your face.
Should masks be cleaned, and how often?
So that's a good question, because typically all the masks that are used in the medical field are single-use masks. However, now because of some of the shortages and some of the contingency planning of making sure that we don't run out of PPE, we're trying to extend the life of some of these masks. So for the most part, these masks shouldn't be washed or anything like that. However, there are different techniques, including pressurized hydrogen peroxide, heat, UV sterilization, that the health systems are looking at as they come closer and closer to feeling like they're in need of reprocessing masks. I think for the general public, the message is that you want to, for your cloth masks, you want to make sure that you're washing them daily in a warm wash bath with soap. And that does a good job of disinfecting these masks to allow them to be reused and not be another carrier for the virus itself.
Okay, that's Dr. Mark Larson. He's an emergency medicine specialist at St. Luke's Hospital. Dr. Larson, thanks so much.
No problem.